Hi and welcome back to VMS Library, your go-to destination for a wealth of knowledge in veterinary medicine. Join us as we explore the fascinating world of animal health, offering insights and expertise to empower our community of pet lovers and aspiring veterinary professionals. Today, we're going to learn about atypical mycobacteriosis in pets, a rare but serious infectious disease. Atypical mycobacteriosis, also known as non-tuberculous mycobacterial infection, is caused by various species of mycobacteria found in soil, water, and organic matter. This infection is associated with a variety of different species of mycobacteria, including Mycobacterium avium, Mycobacterium fortuitum, Mycobacterium abscessus, and others. Pets can acquire atypical mycobacteriosis through environmental exposure. They may come into contact with the bacteria through contaminated soil, water sources, or close contact with infected animals. In some cases, transmission can occur during medical procedures, such as surgery or injections, if proper sterilization protocols are not followed. Atypical mycobacteriosis can manifest differently depending on the species of mycobacteria involved and the affected organ system. Common clinical signs may include skin infections consisting of nodules, ulcers, draining tracts, or non-healing wounds. Respiratory infections associated with chronic cough, difficulty breathing, nasal discharge, or pneumonia. Gastrointestinal infections with symptoms of diarrhea, weight loss, vomiting, or abdominal pain. Joint or bone infections in which pets may display lameness, swelling, pain, or reluctance to move, as well as generalized signs including fever, lethargy, anorexia, or overall decline in health. Diagnosing atypical mycobacteriosis involves assessing clinical signs, lab tests, imaging, and sometimes biopsies to confirm the infection and its extent. The following diagnostic approaches may be used: bacterial culture, collecting samples from the affected site or body fluids and sending them to a laboratory for mycobacterial culture and identification. Polymerase chain reaction, PCR, molecular testing to detect the presence of mycobacterial DNA in samples. Imaging, X-rays, ultrasound, or other imaging techniques may be used to identify changes associated with mycobacterial infections, such as lung infiltrates or bone abnormalities. Biopsy. In some cases, a tissue biopsy may be necessary to confirm the presence of mycobacteria and evaluate the extent of the infection. Treatment of atypical mycobacteriosis typically involves a combination of long-term antibiotic therapy. The specific antibiotics used and the duration of treatment depend on the species of mycobacteria and the extent of the infection. Some mycobacteria may be resistant to certain antibiotics, so sensitivity testing is important to guide treatment decisions. Surgical intervention may be necessary in cases where localized infections, such as skin or bone infections, are present. Completing the full course of antibiotics is crucial. It is important to keep in mind that some species of atypical mycobacteria can pose a risk to human health. Pet owners and veterinary staff should take precautions to prevent transmission to humans, particularly individuals with compromised immune systems. Basic hygiene practices such as hand washing, proper wound care, and the use of personal protective equipment when handling infected animals or their materials are essential. If you have any questions, feel free to comment and we will get back to you. If you learned something from this video, make sure to subscribe and turn on notifications so you never miss a new opportunity for education. Thanks for watching. See you next time.